We're here 3 years post-pandemic, and with the holiday season right around the corner, residents are encouraged to spread joy, not germs. Today on City Chat, Health Commissioner for Columbus Public Health, Dr. Mysheika Roberts, is here to discuss COVID and flu vaccine updates, as well as the measles outbreak and prevention. Dr. Roberts, thank you so much for joining us on City Chat today.
Thank you for having me. Happy to be here.
So I'll just get into it. This year we've seen so many different variants of viruses, COVID, flu. We had RSV, now measles, and flu in particular came earlier this year. Is there a reason why, or can you let us know why we are seeing so many viruses at once?
Well, I think the explanation can be complicated, but for the general public, the rationale is really because we haven't been around each other very much for the last 3 years to spread these viruses. And so what we're seeing is generations of our residents who've never been exposed to these viruses because they were too young. They have not gone to daycare. They've been at home mostly and not been socialized. So you can contribute some of the spread of these viruses to that younger population, but some of it is just our immune system. If we've been walking around for the last almost 3 years wearing masks or doing social distancing, not going to large gatherings, and now all of a sudden we're doing those things without mask on, we're going to be exposed to viruses that have changed subtly in the last 3 years, and our immune system is not accustomed to them. So we're going to respond by getting sick. And so that's what we're seeing in our population, particularly with RSV and with the flu. Now, measles is a whole nother story. So measles is because we have pockets in our population that are not vaccinated. And when you have an unvaccinated population and they've been exposed to measles, they are likely going to get measles. 9 out of 10 people who are unvaccinated who are exposed to measles will get measles. And so we can't put measles in the same category as some of the other respiratory diseases like RSV, like COVID, and like flu. But it is likely going to be a challenging winter for respiratory viruses and for our healthcare system.
Okay, that's good to know. So kind of going back to COVID and flu, what are the, current recommendations for being updated with those vaccinations?
Sure. Well, for flu, it's easy. Every year, we always say, get your flu shot. If you haven't had your annual flu shot for this season, get it now. It's not too late. Please go get vaccinated now. For COVID, a little more complicated, but the bottom line is you should have received your first vaccine series, whether you got it when they first became available to the general public or whether you got it after the fact. And then after you get that first primary series for COVID-19, now there's a new vaccine. It's called the bivalent vaccine. So everyone, no matter your age, no matter your health condition, is eligible now for the bivalent vaccine. So you should make sure you have that on board. But in order to get the bivalent vaccine, you have to have that primary series first. So those are the recommendations. Pretty straightforward. Annual flu shot, if you haven't gotten it, get it now. And for your COVID-19, get the bivalent vaccine now. If for some reason you never got the primary series of COVID-19, get that now, and then you have to wait 2 months to get the bivalent vaccine.
Yeah, great. Thank you for that straightforward answer. That makes a lot of sense, because I'm kind of guilty of this with as far as catching COVID. And, after 3 months thinking that like, oh yeah, like I am in the clear, I don't really have to get like boosted again. I just wanted to give you that opportunity to reiterate why this vaccine or the bivalent vaccine is something that is needed, and just to let the general public know why it's important to keep track of also when you last caught COVID.
Yeah. So, there's been a lot of misinformation and some theories out there that are still a work in progress of whether having COVID-19, the natural infection, gives you some immunity and for how long. And the real answer is we don't really know. We think it gives you some immunity, and it could be anywhere from 4 weeks to 3 months. We're not really certain, and it varies obviously depending on your age as well as your immune status, whether you have underlying health conditions or not. So my recommendation to individuals who've had COVID and are due for a bivalent vaccine or what have you is to not wait too long. Make sure they're completely over their COVID-19 infection. And I would really get that booster as soon as possible after that and not wait. you won't do any harm to yourself by getting it sooner. You could potentially do harm to yourself by not getting it soon enough.
Right. Thank you. With the measles outbreak, you did touch on this a little bit, but we're primarily only seeing it in Central Ohio. Can you kind of just explain why we're only seeing it in Central Ohio, and also why, our children are being urged to get vaccinated as soon as possible? I got a text from my pediatrician last week, just an alert about, the current recommendation is to go and get your child vaccinated if they're under the age of 5. And I just had these like COVID flashbacks of like, when is the shot going to come out for my like 2-year-old and all this stuff. And I was a little upset, to be honest, that, his next series of the measles dose was when he turns 4. So I had a little bit of a, just kind of just froze for a second, but could you explain why that's being recommended right now?
Sure. So back in 2000, here in the United States, we were successful in what we call eradicating measles. And we did that because of the MMR vaccine and having really good coverage across the United States. Since that time, we've had several cases and sometimes even outbreaks of measles. We've had some here in Central Ohio, at least one here in Central Ohio several years ago in the Amish community. So it's not unusual that when we see measles here in the United States now, since it's been eradicated, that it's been occurring in pockets, in what we call clusters and communities.
Okay.
So right now, the outbreak is here in Central Ohio, predominantly in Columbus and Franklin County. It's not a widespread infection that we're seeing across the country. We're seeing this right here. And it is due to the fact that, from June to October, we had 4 cases of measles that imported measles into our community, meaning they traveled out of the country to a measles endemic area. They were unvaccinated. They came back to Columbus, Ohio, where they were diagnosed with measles, and they spread it to others in our community. So that's why we have an outbreak right here in Columbus, Ohio right now. And the reason why so many of our young children have been impacted by this measles outbreak is because that's the greatest percentage of the population that's unvaccinated.
Right.
The majority of our cases for measles in this outbreak have been unvaccinated. We've had a very small number who've had 1 dose of the vaccine, not 2 doses of the vaccine yet. So it is important that individuals in our community make sure they get that first dose of MMR. And we are recommending that individuals who live here in Columbus and Franklin County who've gotten that first dose of MMR, they can get what we call an accelerated dose of the MMR, and they can get that second dose before their 4th, 5th, or 6th birthday, as previously recommended. CDC does offer that accelerated dose when you have a community that's having an outbreak like we are here in Columbus. So you mentioned your young child now, as of today, would be eligible for that accelerated dose by going to your pediatrician or going to your local health department.
Okay, thank you, Dr. Roberts. And my son, I don't know if you remember this, but he was born a day after the government shut down, with COVID and everything. And, just kind of speaking on behalf of, pandemic parents with young children, do you think, in your opinion, that moving forward, we're going to see a lot of vaccine recommendations, like based off of like viral outbreaks? Or do you think this is just kind of a weird year because of COVID and then the measles coming back? Or are we is this gonna be the new thing?
Well, so keep in mind, COVID-19 is a relatively new vaccine. We're very grateful that we have that vaccine, but the vaccine recommendations for pediatrics has not changed in terms of the routine vaccine schedule. MMR has been a part of that routine vaccine schedule for years. Now, COVID-19 is voluntary, right? It's not one of those vaccines you need to get into school, nor do I think, given the current political climate that we're all living in, it will be required for at least public schools, at least in the state of Ohio, anytime in the very near future. Flu also is not a vaccine that is mandatory for school or school matriculation. So I would say again that our childhood vaccine series that we have been talking about for years, like MMR and other vaccines that all children get, hepatitis B, those will continue. But COVID-19, the flu, those will probably maintain to be voluntary. And so this is nothing new that we're recommending with this measles outbreak, but COVID-19 and flu, and if other viruses come up, and if our country is fortunate enough to make a vaccine quickly, then absolutely we would recommend it, but it would not be part of the routine childhood vaccine series at this point in time.
I see. And with measles, I did just want to touch up one point, was that measles is more contagious than COVID. Is that right?
Absolutely right. Measles is probably 10 times more contagious than COVID. So that's why, we say that if you're unvaccinated and you're exposed to measles, you've got a 90% chance of being diagnosed with measles. That's not the case for COVID, although COVID is very contagious as well. It is not as contagious as measles.
Thank you, Dr. Roberts, for everything that you are doing for our city and for just being such a great leader. We really appreciate the time and everything that you've done for us. Thank you.
Oh, thank you for having me. I appreciate it.
I'm Josie Smith. Thanks for watching City Chat on CTV.